Yeah, said we're going to put it in. And the reason we wanted to do that is so we can take them off the tax roll.
But I didn't see a sign there. It went by it. It should be one.
Yes, I agree 100%.
I'll play Jenny.
Thank you, Mr. Doldo. Good evening. I'd like to call the April 26, 2016 Health and Human Services Committee to order. Is there anybody from the public who would like to address the committee first off? Okay, seeing none, we'll go into a presentation that our Director of Public Health would like to make.
This is the Public Health Works Honor Roll Award. It was begun by the late Commissioner Richard Daines and continued by successful state health commissioners. The New York State Department of Health annually recognizes individuals or teams of individuals in local health departments for the vital work being accomplished to improve public health. Public Health Service was pleased to nominate the entire Public Health Prevent Services team in recognition of their dedication in the department's preventive service unit. On March 30th of 2016, we received notice that the team was chosen by the Commissioner Zucker. Public Health Prevent Services team leads core public health program in Jefferson County, including communicable disease reporting and control, health promotion programs, rabies and vector control, public health preparedness, physically handicapped children, children with special health care needs program, lead poisoning prevention, diagnostic and treatment services. It encompasses immunization clinic, STD, HIV clinic, and travel health services. This group right here does all of that. This team perpetuates the department's mission to empower people to maintain best health by delivering programs through the 3 core public health functions and 10 essential public health service framework. In addition to the coordination and delivery of programs, this team is working to develop the department's strategic plan and actively implementing quality improvement processes to achieve measurable improvements in the efficiency, effectiveness, performance, accountability, outcomes, and other indicators of quality in services or processes which achieve equity and improve the health of the community. This team is also leading the efforts in getting our department to be accredited. What we have are certificates and letters from the commissioner. Lisa Bass. Sorry.
Lisa Bass.
Thank you. Jessica O'Hara. Jeffrey Leindecker.
I'm supposed to be on the phone before, right?
Yeah. Patricia Barton. Deborah Foisey. Kathleen Biggs. Deborah Siver. And there's Faith Lustig, who is unable to attend this evening. Could I get a picture real quick with you, with all of them?
Sure, who's taking it?
I will. We have an agency newsletter.
Want to see what's in front?
Right
up in front of the
We're going to go right into Patricia. Patricia.
Aren't you supposed to be in this too?
Give me your phone, and you guys go.
Okay. Is there any additions, deletions, corrections to the minutes from last month's meeting? Seeing none, we'll move into our resolutions.
First resolution this evening, amending the 2016 county budget for Office of Aging relative to Delivery System Reform Incentive Payment Program.
Motion, Mr. Ferris, I believe. Second? Mr. Doldo. Any discussion? All in favor? Aye. Carries. Ginger, would you please open the doors back up?
There's a big secret meeting going on.
Yes.
Next is amending the 2016 county budget for community services relative to the Delivery System Reform Incentive Payment Program.
Motion? Mr. Docteur, second. Mr. Ferris. Any discussion? All in favor? Aye. Opposed? Carries.
Next is authorize an agreement with the Fort Drum Regional Health Planning Organization for telehealth services.
May I have a motion, please? Mr. Dodo, Mrs. Fitzpatrick. Any discussion? All in favor? Opposed? Carries.
Authorizing amended agreement with Allscripts for the purchase of an interface between Allscripts and Healthcare Connections.
May I have a motion, please? Mr. Docteur. Second, Mr. Dolgo. Any discussion? All in favor? Opposed? Carries.
Authorizing agreements with emergency medical services agencies relative to the Jefferson County Public Health Service.
May I have a motion, please? Mr. Ferris. Second. Mrs. Fitzpatrick. If I may, if Ginger would please come to the podium and give a little bit more explanation as to this resolution. I also have a couple of questions.
Sure. We've been partnering with EMS for years, and with the DSRIP, there are funds going to EMS, and they have to have a project, and so we have been entertaining this idea of collaborating in the community. And so DSRIP would pay EMS for a project. So the project that we want to do is to work with EMS in seeing public health patients. We would work together on what we're going to assess. We have specific zone teaching sheets. It says green, you're where you need to be. When you start to go into yellow, you're not doing as well. Red, you need to get a hold of your doctor, or 911. So we would have standardized protocol. So what we want to do is have us admit a patient to service that would have COPD, CHF, pulmonary function issues, congested heart failure, pneumonia, diabetes. We would do a coordinated visit, and then if we are visiting Monday, Wednesday, Friday, EMS would go on a Tuesday, Thursday, or Saturday, a day we're not there, and see how the patient's doing. And if there was anything different than what they have found in the past, they would report it to public health, and we would make an extra visit to prevent an ED visit or a hospitalization. We would go out and see that patient. At this time, DSRIP would be funding them to do this project that we've been wanting to do for quite a while. Talked with Raleigh Churchill at Tiers, and because we've been going back and forth for years trying to figure how we can fund it, how can we do it, and he is willing to be Tiers is willing to be the pilot for this, to see how it goes, and then we want to expand it, provided it goes well, to other squads. So Tiers has a CON for the town of Clayton and Orleans. Our plan is if we have enough patients in those two towns, that's where we would, Tiers would stay. I am meeting with Lee Burns, who's the Director of the Emergency Medical Services and Trauma Systems, to talk about this. She's the New York State out of Albany representative for EMS. Because it's a public health extension, they have allowed them to go outside their boundaries of a certificate of need if we don't have enough COPD, CHF, diabetes patients to see how it's going to work in those two towns.
Is there any questions from the floor? Mr. Doctor.
Thank you, Mr. Chairman. Tiers, you mentioned Tiers. They have a CON for Lafargeville and Clayton, but they also service the communities surrounding them, which has been an issue. So
Right.
Would they be able to provide this service, experimental service in those areas also? I think you mentioned that they have to have the CON.
Yeah, they have a CON for Clayton and Orleans. Because it's an extension of public health, that's what we're going to ask when I meet with the director, that if we have patients in those areas and we want around 30, we think 30 would be a good number to pilot, to keep working with, that if we can achieve it in those two towns, can we do, extend it to outside of their certificate of need.
Thank you for doing the reach out to the administrative that you're investigating on the CONs. And,
Yeah.
I had brought that up to you last week,
Yeah.
but I guess in continuing on with that and talking about the CON is something that's very specific for each EMS and where they service. The one thing that I point to within the briefing is it makes mention that if a staff member finds a patient in crisis, they will immediately initiate emergency medical services, which is, the absolute best thing that we're trying to achieve through this. It's just the issue then becomes, though, with that CON, it becomes their patient essentially then. And that's the importance of establishing is that CON allowed for them to exceed that boundary, because then we become on an issue of crossing turf, so to speak.
Right.
And that becomes their patient, which becomes something that is billable for them, I presume, if they need to be the transport. Is that correct also?
It would be billable for them. We have past experience where with Ebola, the border officers could not take a temperature. They couldn't take it, they couldn't read it. So the state was setting up that we would send a nurse 24/7 whenever it was needed to go to Wellesley Island to take a temperature. So we talked with the state, we worked with Tiers again, provided them with a thermometer, and they went, because they have a fly car, they could go out, they took the temperature, gave the reading to the border officer, and did that for us as an extension of public health. Wellesley Island, they were able to go to, the state health department approved that, allowed them to go to Wellesley Island because they were an extension of public health. And it was allowed, and we put out a notice to everyone that they weren't doing an EMS call, they were doing an extension of public health activity. And everyone knew that. We put that out to all the EMS agencies because we didn't want to step over anybody's toes.
Mr. Navalanek.
Thank you, Mr. Chair. I'm not on the committee, so I appreciate the opportunity. So Guilfoyle was made aware of the situation, or?
Of this particular pilot? No. This pilot?
Right.
No, because Tiers and South Jeff are the two that I know that are at the DSRIP table. and they're the ones getting the money, so that's why I started with tiers.
Okay, because going back to when I was on the committee, the whole uproar was we have a private company in the county with private payroll, and then you have not-for-profits, and then Guilfoyle does have a countywide CON, and then, you know, kind of superseding, and the tiers was trying to expand their area through, and that CON is the key, obviously.
It is.
So that was the ruffle in between. And I don't know, I mean, it just, you know, it would be, you know, we have a private company here too, and they were kind of left out of the opportunities. I just kind of walked into the meeting late, so maybe I don't have all my facts.
I'm
but-
starting with tiers.
Because we were heading down that through FDHPO.
This is very different than that process.
Okay.
I mean, this is us, public health and EMS working together in patients' homes, not a countywide CON type thing. This is just us working with EMS in homes.
Well, when we do have that provider in the county, why would they, I know, why were they just left out of the process then? Or do they know that this process is going on? And I could see that being a problem where they weren't, you know, they find out through the newspaper about this, and the county is on board with it.
The Fort Drum Regional Health Planning Organization with Samaritan are the lead on the DSRIP, and I don't know if they put out notices to everyone who wanted to participate, and then they had to agree to participate. That piece, I don't know how Tiers and South Jeff came to the table.
That's a very sensitive issue, Ginger, because, you know, back when I was, that was a big rub and stuff, and I would just feel better, you know, if Guilfoyle was aware of this whole process and what was going on, and see what their thoughts are on it too. So, okay.
I think possibly maybe, you know, I don't know how you wish to approach this at this point, but it may even be as simple of a solution that if this is the group that you're committed to working with on it, they may be the ones to go out to assess, and they may be going out and assessing individuals outside of their coverage area. But still, when it comes to that becoming a critical emergency medical service, that the priority still belongs with the one who has the primary CON there. And that might be the best way to make it clear with the pilot program.
Yeah, we can set that up as a protocol.
Yeah, because yes, there was a bit of a turf issue in discussions on that point, but I think what you're trying to do with this program is very worthy and noble. I don't gather from any of the committee members at this point that they don't see the value in this, and going forward it's just that sensitivity that we want to make sure that is known on the forefront with this.
Yep.
Now, is there a particular reason that this stream of funding that some of the other agencies within the county don't come to work with you for the DSRIP?
I don't know how they became involved with DSRIP, with Fort Drum Regional Health Planning Organization. I don't know if it was a general invitation and then those that responded came to the table. I know we're the only DSRIP that has EMS at the table. The rest of them in New York State do not have EMS at the table. And as I said, this is a pilot to start with Tiers. Where our goal is, if this works, we would expand to those other EMS squads that want to work with us.
It's worthy of note, I think, that there are really two beneficiaries for this initiative. One is certainly a patient, but the other party is Jefferson County Public Health, because it's also helping to lend assistance where we're having such a problem getting nurses on staff. So it's a backup with a funding stream that is not Jefferson County, and it's not available to Jefferson County. So we're taking advantage of a different program out there, but we're not necessarily the lead agency. We're the beneficiary. So it kind of becomes a win-win. And what Ginger had indicated to me earlier is because it's a pilot, if it's successful, it's going to broaden. In that sense, it's going to cover the concern, Mr. Chairman, observation that you're making, because there is that little situation that evolves when you're on a scene. Now you're in somebody else's territory. How do you deal with it? In theory, a little bit down the road, whether it's a not-for-profit or Guilfoyle is a for-profit, they'll all be on board with this thing, but you got to start somewhere, and I think that's what's happening in this particular case.
Correct.
The companies that were made available to you through the bigger organization were those two in particular.
Correct.
We didn't really have the choice to go with anybody else. It's one or the other, is what I understood.
Right, if we want to tap into the district funds, and they need to have a project, so it was a perfect project because we both are going to win in this situation. They're going to get funds, and we're going to get additional supplemental services.
Thank you again, Mr. Chairman. Just a follow-up question for Tiers, maybe a comment. The reimbursement rate for this service to the EMS, is that negotiated, or is it probably a set rate?
I'm assuming it's a set rate. They get so much money to provide so much service. That's how it's working for us. We have certain deliverables, and we get a certain sum. Community Services is going to get a sum, and OFA.
If they agreed to it, apparently they were satisfied with the amount. Yes. And just a comment, I do appreciate my colleagues' comments on the issue with CON and the private versus public sectors in this, but it is, Mr. Hageman did mention, it is all about the patient, and there is certainly a need for a higher level of care in this area, especially when you get out into the northern part of the county and some of the outer areas of the county. So I applaud your efforts, and I hope this pilot turns into much more, and we can use this throughout Jefferson County.
Certainly support this. It's a great idea. Never said that wasn't. Again, though, my concern, and I will concur with Legislator Nabowanic, at some point the private company should be notified, just out of respect, that's all. We're not looking for them to join or anything like that, but out of respect, because, as he says, we've been there, done that, on another issue that, a few years back. But love the idea and hope it takes.
And I think I'll follow up with that, is that, I think as a matter of a practical standpoint, if you're talking about Tiers is going to be having an individual running around with a fly car anyways, correct?
Correct.
So they most probably wouldn't even be able to transport a patient anyways.
Right, it's not an ambulance.
So in most cases, the CON of jurisdiction would most essentially be the one that's called to the scene anyways.
Right.
And so in that effect, that whatever one may not be available, because that does happen at times, Guilfoyle may still have the opportunity because of that. Mr. Nabowanic.
I appreciate the opportunity again, and like I said, I kind of walked into this, so I apologize and stuff, and that was good information, Bob, so I appreciate that. But I do think that Guilfoyle does keep, they when I was chair, they had an ambulance stationed right up in Elks Bay. They had an ambulance a lot of times stationed right in Cape Vincent, so, they would be close to respond too. And they had the CONs for those areas, and Elks Bay didn't want Tiers coming in. It was just a big mess. So the more we're up front, I guess, with everybody on the front end, and I agree, what the patient and the service, it sounds like a great idea, and I'm not against it, obviously. I would support anything for that, but I just think that would be the best way to go about it, that's all. Okay?
Are there any further questions from the committee? I have one last, a quick, small one. No, we hadn't passed it yet. As I was going through this and going through the summary there too, and it makes mention of, this is an individual that comes and, inspects an individual, and if they deem them of necessity of going to an emergency room, they're essentially compelled to do so. Very compulsory. Now, is that something that our staff also do when they come to evaluate somebody, that if they deem them medically necessary to go to an ER, then they are directed there?
Yeah, when we do an evaluation, we usually call the physician first if it's during, their normal work hours, and report to them with the hopes they could get them in first, someone that knows them, and if they cannot, then we send them to the emergency room.
Okay. My simple reason in asking is that, is that individual, that patient that is going to be seen, is they being forced to go to an ER when they ordinarily would not. So that was my only question, but...
We can't force them. I mean, we can call an ambulance and they still can refuse to go.
Okay. Mr. Ferris. Mike?
Clayton.
Hello?
Testing 1, 2. Thank you, Mr. Chair, for recognizing me, because I am on the committee. When they show up to the house, not you guys, but when Tier shows up to the house, will they show up in an ambulance or will they be in their car?
It'll be a fly car.
Okay, a fly car is just,
A marked non-ambulance.
okay. So they would call an ambulance from that point, or they would take that person in their fly car?
No, they would have to call for an ambulance.
Thank you.
Any further questions? Any further discussion on the resolution? All in favor? Opposed? Carries.
Next resolution, authorizing agreement with Lewis County Public Health Agency for Cancer Services Program Outreach and Educational Services in Jefferson County and amending the 2016 county budget in relation thereto.
May I have a motion? Mr. Ferris. Mrs. Fitzpatrick. Any discussion? All in favor? Opposed? Carries. Well, that looks like that's it for the resolution. Is there anything further to come before the committee tonight?
I would simply note, Mr. Chairman, just, you may have seen the notice already, but for the month of June and July, if you have a desire to park over by the DSS office, you can't, because we're actually doing our capital improvement at that point in time. Hopefully within about a 60-day time period, it will all be taken care of. There'll be major renovations undertaken beginning in the first part of May.
Yeah, thank you very much. One other thing that I will make note of real quick, and I had spoken to Ginger about this, seeking some information on it a little bit last week. I happened to notice it in the media that it was Erie County that is doing a big push on prescription drug drop boxes. And come to find out that April 30th, I believe it is actually a national prescription drug drop-off day. And I just wish to make that note to the committee members that, as we talk about opioid drug abuse and misuse and the issues within our community, that is only but one prescription drug that people can abuse. And certainly those that have extra prescription drugs that they don't use and they sit in your shelves. Kinney Drugs and Samaritan, they do drop boxes and drives once in a while, but we also have a regular drop box at the Public Safety Building in the Sheriff's Office, which is open all the time, I believe. Is that correct? Okay. So it's open and available during lobby hours, so I guess it's not necessarily something that we think about, but I'm pretty sure a lot of us have some unused drugs sitting in our cupboards that, yeah, you use them all. Legal drugs, yes. But
Brian, you just got your headline for tomorrow.
Something that it brought awareness to me, and I thought that I would share it with the rest of the members of the committee. Now, the only thing that is different with Erie County is that they take not just your prescription drugs, they will take over-the-counters, and they will take needles, which at this point nobody in the North Country does, I believe. So it's an interesting difference, but certainly something that might get pursued in the future. Anything else? Motion to adjourn? Mr. Doldo? Mr. Docteur? All in favor? We're adjourned.
it is. Florida. Yeah. Florida. You want to meet? He went to school with Mom.
How does Jenny do it? I just want to be Jenny for a minute. Where is Jenny? Where is Jenny? I thought she was on financial.
I'd like to call to order the county's Finance and Rules Committee meeting for April. Looks like privilege of the floor for all those folks who it's always crushing when everybody leaves when it's my committee meeting, but that's all right. Privilege of the floor, okay. Anyone? No. The minutes, corrections. Apparently I'm not controversial. And that's the way I intend to keep it. Privilege of the floor. Approval of the minutes of the last, are there any corrections, additions, deletions to the minutes? Last meeting? They stand as presented. On to resolutions.
First resolution this evening is approving mortgage tax report.
May I have a motion, please? Legislator Nabawanek, Legislator Drake. Discussion on the motion. Hearing none, all in favor? Aye. Opposed? Motion carried.
Next, calling for an increase in the share of revenue counties retain for providing state DMV services.
May I have a motion, please? Legislator McBride, Legislator Johnson. Discussion. Hearing no discussion, All in favor? Opposed? Motion carries.
Authorizing reappointments to the Jefferson Lewis Workforce Development Board.
Have a motion, please? Legislator McBride, I don't know who's handing up first. Legislator Nabawanek, thank you. Discussion. Hearing none, all in favor? Opposed? Carried.
Next is amending the management compensation plan for 2016 for the county administrator. Give it a try.
I think the motion as written is not quite as stated, amending the management compensation plan for 2016 without the administrators being referenced. May I have a motion, please? Legislator Doctor, Legislator Johnson. Discussion on the motion. All in favor? Opposed? Carried.
Next is calling on the state of New York to fully reimburse counties for district attorney salary increases set by the state.
Motion, please. Legislator Fitzpatrick, Legislator Drake. Discussion. Not a comment. All right, that's okay. Legislator Peck.
Thank you, Madam, or, Mr. Chair. Thank you, Mr. Chair, for allowing me to speak. Just a quick question, I guess. If we had not approved, if the committee had not approved the last resolution, would you still be compelled to compensate her since it's dated April 1st?
Actually, John, that's a very good question. It's a state law now. We are compelled. Honestly, given the magnitude of the problem, and it's statewide, not only just here, there was some thought about when we hold off from a law, because some counties are actually doing that. But the reality is, it is retroactive to April 1st, so whether we do it now or whether we do it in July, it's still retroactive to April 1st. I would venture a guess almost every county in the state is passing the very same resolution seeking support to make an amendment to the state budget before the legislature ceases at the end of June. But again, strategically, some counties have decided to hold off. We chose to move forward simply because the issue is not our local DA. The issue is something at the state level, and let's get it behind us and still go ahead and lobby Albany to make the change. At the present time, you didn't ask, but let me advise. Right now, for a salary of $153,000, about $72,000 is covered by state. And you may recall that about 4 years ago, we went through this process. There was a 3-tiered adjustment period, but for all 3 adjustments, that differential was covered by the state. Also, in that time period, there had been at least 10 years before there had been an adjustment for judges or the DA or anybody else that fit that particular mold. This time around, obviously there's not been the 10 years. What the rationale was one way or the other, we've never seen any explanation, nor have we ever gotten anything officially in writing from Albany, but it is law, so we are obligated to do it.
Further comments, Chairman Gray?
Statewide, the DA salary number is $1.6 million, For us, it's 30,500, but depending on the area of the state, there are other factors that come into play. Frankly, the more urban areas probably a little bit more, and the more rural areas probably a little bit less. But on average, it's a $30,500 adjustment.
Legislator Peck?
So they have some sort of scale that they go by to determine who gets what kind of a raise then? Is that
I
what
believe
you're
the
saying?
answer is yes, but I'm not familiar with what the particulars are.
The way I read the resolution that I saw, information that came from NISAC, it made it sound like anybody who wasn't making up to that 183,000 would get the raise. Anybody making over that wasn't going to get. If you're in Westchester or somewhere making 215,000, it's moot. That's the way I understood it.
But if you're, I just need to understand a little bit more how this is all set up. You know, I can understand that this is tied to state Supreme Court justices who are lobbying hard to have a raise of their own. This is just kind of collateral damage that DAs also end up getting a raise because it's all lumped together, correct?
So the state statute that way, correct.
Right. So why, you know, just why the scale is the way that it is and how it's set up. So, so to speak, that if somebody's getting an increase up to a certain point, as you just said, then why was somebody already at such a high level to begin with? And that if they're not getting an increase, but we're forced to have an increase.
Well, because it's tied to the judge's salary, and in places like where we are, rural areas, DAs make less money. If you're in a county that has, you know, more municipalities, a larger population, 3 million people in Westchester County, just bigger job, bigger salary.
If I may, I think the misunderstanding is that the judges in a place like Long Island, state judges, would probably make more than they make upstate. Therefore, the district attorneys make more because they make a certain percentage of what the judges make there. So they're already pegged at a higher salary than comparatively, again, to upstate. So they're already somewhat higher than what the salaries are here. What this increase has done is now set the judges' salaries at a certain percentage of the federal judges' salaries. They're trying to pin the state judges' salaries to the federal judges' salaries to bump everything up the scale, with the district attorneys being following along at the bottom. Is that?
Again, that makes sense, and that just makes completely ridiculous logic that our state judges should be tied to the federal judges, because they're not the same. You know, why should we be paying more because the federal government pays their judge more? You know, much less why are their judges and DAs higher valued than ours, that they deserve a much higher salary downstate compared to ours? You know, I can understand that's probably cost of living, but you know, in relative fairness of government, is just not.
That was the actual rationale of the commission that set this latest increase.
Our resolution is going to our 3 elected state representatives, and then we can always go see them ourselves. And thank you, Attorney Paulson. Further comments on this resolution?
Mr. Chairman, let me just make one more observation, just so everybody knows. The law has now established it's retroactive to April 1st. But again, 2 years out, in 2018, there'll be another $10,000 adjustment. I think it's 2000. That's 20,000? Oh, I thought it was 10. But the reason I bring it up, though, it may be, I thought it was 10,000, but maybe it's more. But because that's down the road, we will budget accordingly. In this case, we had not budgeted. This is why we have to go through this exercise, because this is all from the standpoint of approving a budget, all after the fact.
Further comments or questions, discussion? Okay, hearing none. Motion as read, all in favor? Opposed? Carried. reluctantly.
Next, reappointing Director of Real Property Tax Services.
Have a motion, please. Legislator Fitzpatrick, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Motion's carried.
Authorizing the purchase of real property for the purpose of establishing public access to the Slack Lot County Forest Reserve in the town of Champion.
Motion, please. Legislator Doctor, Legislator Fitzpatrick. Discussion. Legislator Peck.
Thank you, Mr. Chair, for allowing me to speak at your committee again, Mr. Chair. I just wish to kind of offer a little bit of explanation for the resolution for some of the members that this occurs within my township, and it's been a long-standing dispute of a right-of-way within that township, stemming back to when the town, as it mentions, abandoned the road in '97, and yet you still have to have your easement to be able to access a dedicated county reforested area. So a survey was performed by the Soil and Water District that kind of reestablished the boundary line where it belongs. It's just that to be able to protect the neighboring landowner and to make sure that we have the full support of the board is the necessity for this resolution to go forward. So it's I very much appreciate your support, and to finally put this issue to bed, which has been simmering for better than 20 years, back when Jay Madison was director at Soil and Water and Gary Eddy was a forester. So it's been an issue that's been kind of pushed to the back burner for a long time. So thank you for support.
I'd like to thank Attorney Paulson for getting this on to tonight's resolutions. It's a big issue at Soil and Water, which Legislator Peck and I are both directors of, so thank you. Okay, all in favor? Opposed? Carried.
Last resolution is authorizing the chairman of the board to execute certain purchase agreements for real property to be used for radio transmission towers for the emergency management radio system.
Motion, please. Legislator Neblianek, Legislator Johnson. Discussion. Legislator Doctor.
Yes, could we get a little greater detail on what we're agreeing to, what purchasing, what are we purchasing?
Well, in a very general sense, Mike, there are 12 locations that we've targeted to erect the towers for this new program, and in the interest of time, we simply want to be positioned to be able to make the formal offer to these without coming back to the board every single time. Ultimately, it comes back to the board for approval anyway, but this is giving the authority for the chairman to proceed. Frankly, at this point in time, I think everything is pretty well aligned, so we're in very good shape. But especially from the standpoint of wanting to get this done so that we can proceed to move forward and charge a good deal of the cost of the $6 million grant that we have in place, and that needs to be spent by year end. Time is of the essence. We're moving very, very quickly, but I mean, this is a bureaucratic step that we need to take, and we can either do it individually or do it collectively. And to that, I'll turn over to David because he prepared it.
Yes, I'm expecting in the next month and a half, we're going to have quite a number of purchase agreements with the chairman to sign with various municipalities that we are going to be purchasing their land, either through outright purchases or through easements, put the towers up on town land. That's primarily what the point of this resolution is, so the chairman can sign them when we need to have them signed, rather than having to come back to the board each time and having to go through the month-long process of getting them authorized. I don't envision it being used too much beyond the purpose of those agreements, but I did want to have the flexibility for negotiating, thank you, negotiating and being able to purchase whatever we need for the 12 tower site. So that's the purpose of this.
thanks for the explanation, and I just would add that most of these properties are going to be on public properties. The one in my district, I did report to the local planning board, just not for permission, but just for an explanation, so the community would know what we're doing, and not to set a precedent, but it certainly was well received in my community, and again, our committee's done a great job with this, and there's a lot of moving parts to this, and it certainly isn't over yet. We're just at the end, maybe in sight. So, good work to everybody that's been involved. He really is. Nice work, Mr. Kulo.
Kudos to Legislator Doldo for all his work. I think we still have a motion.
That's correct.
And we're going to have to vote on it, I suppose. Yeah, Legislator Peck.
Just a quick question. I presume that there's probably policy already in place as far as monies that, what's the money limit that he can negotiate with? Is there already something in place outside of this, or is that required within this resolution also?
What I put in the resolution is that the chairman would do it in conjunction with the ad hoc committee that's in place. Frankly, of the remaining sites, I don't believe there will be any monetary purchase price to be negotiated. They're all, as I indicated, municipal sites. There may be some horse trading, so to speak, of non-monetary issues that have to be decided, but I'm not anticipating any dollar amounts that have to be committed.
Legislator Doldo.
John, right now, the way it looks, most of them are in municipal agreements, and there's one property that we're purchasing. So, that's all. Make it short and sweet.
Sounds like the answer to your question is no. There's no ceiling. Further comments? Okay. All in favor? Opposed? Motion carries. From the General Services Committee, resolutions.
Amending the 2016 county budget in relation to the Sheriff's Department.
Have a motion, please. Legislator Drake, Legislator Fitzpatrick. Discussion. Hearing none, all in favor? Opposed? Carries.
Amending the 2016 county budget to recognize insurance recovery and allocating same in the Sheriff's Department budget.
May I have a motion, please? Legislator Doctor, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Carried. On to Health and Human Services Committee-sponsored resolutions.
Number 1 is amending the 2016 county budget for Office for the Aging Relative Delivery System Reform Incentive Payment Program.
Have a motion, please. Legislator Drake, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Motion carries.
Amending the 2016 county budget for community services relative to the Delivery System Reform Incentive Payment Program.
Motion, please. Legislator Doctor, Legislator Johnson. Discussion. Hearing none, all in favor? Opposed? Carries.
Authorizing agreement with Lewis County Public Health Agency for Cancer Services Program Outreach and Education Services in Jefferson County, and amending the 2016 county budget in relation thereto.
Motion, please. Legislator Fitzpatrick, Legislator McBride. Discussion. Hearing none, all in favor? Opposed? Motion carries. Just to one informational item in the packet from the county clerk. Anything further to come before the committee? Hearing none, a motion to adjourn. Legislator Navalanek and Fitzpatrick. Discussion on that? We're adjourned. I do.